My topic is the variability and the inter-rater reliability of ultrasound imaging of fascia and muscle. In this topic, there are lots of confusion in the literature for a lot of things. And the group of Carla Stecco with Caterina Fede wrote this review about the morphometric and dynamic measurements. The questions are about the terminology. There is a different terminology between the physician, for example, and the scientific research. When we talk about, for example, the superficial fascia, the physician wrote about, for example, the superficial border of the deep fascia and not the superficial fascia, because the superficial fascia is the membranous layer of the hypodermis, and the terminology anatomica is the tela subcutanea. And this is an important, I think, problem nowadays to compare the data and the results among the various articles. And another problem is the fascial properties. What measure the thickness, the gliding, the echogenicity, the stiffness. There are different papers written by Professor Carla Stecco with the collaboration of Jan Wilke about the possibility to correlate the fascial thickness and the aging and the flexibility. And also the possibility to correlate these parameters with the myofascial pain. For example, this paper written by Professor Antonio Stecco about the myofascial neck pain. But there are a lot of confusion about the position of the probe, the scan protocols. What is the position of the probe? What is the position of the patient during the evaluation? Consequently, there is another problem, the reliability of these measurements, the inter-operator reliability, but also the intra-operator reliabilities. I think that I seem the man of the confusion in literature, but this is the reality in this moment in the scientific literature about the number, for example, of the measurements, the mean values, but also among the possibility of to develop a computerized software program for evaluating fascial gliding. For me, the two main questions are, what are we seeing? And is it possible to see the same structure? For this, we wrote a commentary about this topic, and we correlate the our scheme, our histological specimens, and an ultrasound image, and the image speak for themselves. There is a crucial and important correlation between, for example, the image of the superficial fascia and the superficial fascia on the histological specimen, but also for the deep fascia. This is the superficial fascia. This is the superficial fascia. This is the deep fascia. Is different the terminology, and is different the structure. And also inside of the subcutaneous tissue is possible, as Sterzi wrote in the first part of the last century, the difference between the superficial adipose tissue and deep adipose tissue. And for this, we entitled this commentary, Ultrasound Imaging of Fascial Layers. You see only what you know. And it's possible to measure, and it's possible to have a good inter-rater reliability if we measure the same thing. For this, we wrote another paper about the measurements of abdominal muscles and fascial thickness in the abdominal wall. We summarized a lot, and we measured a lot of points in the abdominal wall, muscle, the thickness of the muscle, but also the thickness of the fascial layers during the relaxed situation and during a situation. And we used 3 radars. One radar with 10 years of experience in ultrasound imaging of fascia, and two radars with different experience. And the results of this is an image about the protocol is important to restore the anatomical lines, because the anatomical lines are really important to understand the real point to measure the fascial layers, and are important as landmark to measure these fascial layers. For this, in this paper, we used the linea alba, the rectus, the rectus abdominal sheet, and the border between this and the other part of the abdominal wall, the mammillary line, and also the anterior axillary line. And the image is similar than the other. The image of our commentary is different, only the topographical region. For this, this is a sort of video, and is real, really important to underline the difference between the thickness of the muscle and the thickness of this area. Is easy to measure and to see this line, and is different, for example, in a contract position, where we have also an increase of the thickness of the muscle, but for the fascial is the same, the thickness. We have the results about our paper, and the crucial point is that these measurements are similar among the different radars, among the radars 2, radar 1, radar 2, and radar 3. And the intraclass correlation coefficient of this measurement is similar to the muscle. So it's possible to affirm that it's possible to measure the fascia with the same reliability of the muscle. And the translation of this is another paper about the possibility to use this protocol for the patients with C-cesarean and vaginal delivery. And in this population with scar pain, low back pain, pelvic pain, is possible to find a difference, a significant difference between cesarean section, vaginal delivery, and nullipar people. So we can use this parameter of thickness to underline the difference and correlate the possible role of the fascia in this pain. Another is the gliding. The gliding is a sort of Cinderella in the literature, because a lot of other researchers prove to measure this gliding. Is very difficult. We use this for the relationship between the fascia around the median nerve, and also in different population, and in a population with a problem of carpal tunnel syndrome, is possible with a formula of that uses centroid coordinates to underline the difference of displacement among the different structure among the nerve and the fascia. In this travel, another parameter is the stiffness and the correlation with the echogenicity. For this, we wrote with Antonio Stecco in the European Journal of Translational Myology the possibility to create a sort of matrix and correlate the alteration in the palpation, and so in the stiffness during the physical examination of these patients, and the echogenicity of this patient. And in the different situation is possible to correlate, for example, the sarcopenia and a different stiffness, but also is obvious for the fibrosis, is similar for the densification when we talk about the alteration of SEM inside this tissue. There is a different scale of the gray. It's important the knowledge of disease structure, and it is important the knowledge about the ultrasound machines and the parameters of these ultrasound machines. And another, and we are finishing my presentation, and we published other articles about the possibility to use the sonopalpation. Why not to introduce the sonopalpation of the soft tissue in the context inside of the physical examination of this patient in a fascial point of view? And we published this topic, for example, for an alteration in a scar of a knee of the subcutaneous tissue is a real difference between the normal side, because in the normal side with this we have a linear superficial fascia, linear subcutaneous tissue, but is different in the knee with the scar, and is a similar this sonopalpation, but to use this sonopalpation as a sort of traction during the physical examination for radiating upper limb pain in a fasciatum point of view, and not only in a dermaton point of view, and is strange, but also in a terminological point of view is different, this structure from this, because this is the superficial fascia that envelops the lipoma, and this is the deep fascia, the muscular fascia. So I finish my presentation with a sentence by Grace Murray Hopper, and for me the most dangerous phrase in the language is we've always done it this way. I think that ultrasound imaging and the use of the ultrasound imaging is changing, but it's important to introduce the fascia, the study of the connective tissue, but a real study with the knowledge of the anatomy in a different manner, integrated with the physical examination. Is possible. We demonstrated this with some articles in the last 2 years. Thank you so much. I want to thank my director, Professor De Caro, and my supervisor, Professor Calasteco, and the group of the Institute of the Human Anatomy. Thank you.
Grazie, Carmelo. Question, please. We are very far from the typical interest of molecular biologists, but could be very interested to try to integrate the two community of people. If not,
yes, but
sorry, yes.
No, I think that in the future there are a lot of studies in this moment to introduce also the ultrasound imaging in the basic science, to make a real evaluation and measurements, for example, of alteration of the tissue, also with the ultrasonography in the lab. And I think this is the future. Maybe the next year we can also have other evaluations.